So you saw Mrs. Gonzalez?
I did indeed.
Okay, let's hear about her.
She's a 65-year-old woman with a history of hypertension, tobacco. She's here today with shortness of breath. She reports it's been going on for a few weeks. Initially started only when she was running to catch the bus, and now she's starting to have worse shortness of breath just going up the stairs.
Let me just take a look at her chart.
Oh yeah, I was going to show you that. So she goes up to her third floor walk up and has to stop on the second floor landing to catch her breath, and slowly she starts to feel better and can go on walking. No associated chest pain or palpitations, no sweating, you know, at the onset of the shortness of breath. Never had this before. She's usually pretty active, walks about 3 miles a few times a week with her neighbor. As I mentioned, she does have a smoking history, about 15 pack years, half a pack for the last 30 years. And she has the hypertension, well controlled on metoprolol for like the last 5 years or so. She reports that she's using 2 pillows at night, you know, kind of fluffy pillows, but she used to only use 1, so she's kind of wedging herself up a little more. But no recent lower extremity edema and no PND.
Okay. All right.
Physical exam, well, you know,
just
she's
pertinent positives.
Okay. She's no acute distress. Vital signs of 130/82, temperature 98.2, heart rate of 74, respiratory rate of 18, and she's satting well on room air at 99%.
Good.
Her neck is supple, no JVD. Heart regular rate and rhythm, no murmurs, rubs, gallops. Her lungs sound okay, except for maybe at the base. She's got good air movement, but I think I hear some faint crackles at the bases bilaterally.
Okay.
Her abdomen is soft, non-tender, non-distended. Bowel sounds present. Extremities warm, well perfused. No edema, cyanosis or clubbing. Good strong pulses radially and dorsal pedal.
Okay.
So for her assessment and plan, so I was thinking maybe
so LVH. So looks like LVH. No ischemic changes. So 65.
I think maybe we should order for her. An echo.
Let's go see her. Well, an echo. Yeah, we'll check for check her EF. Maybe it sounds like she has some CHF, so we should look into that. Probably also you're thinking about angina or maybe even an MI. So let's talk a little bit more about that.
Sure. So let's go see her. We need to get some
labs.
Yeah.
Get some labs. Maybe like potassium, creat. Look at her electrolytes.
CK.
And she might actually She might actually need some Lasix, right? If you think she has some CHF going on.
That sounds like a good idea.
When should we see her back? Let's go see her. But if we start her on Lasix, when would you want to actually see her back? Probably a couple of weeks.
Yeah, that sounds about right.
Okay, well, let's go see her.
Okay.